The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Welcome to Pain Free Today with your host, Denis Thompson. Brought to you by Worldwide Advanced Medical Technologies, LLC. Call 954-256-0045 or online at painmanagementnetwork.com. Here you will learn how to eliminate your pain. You will learn about a revolutionary new therapy called the ARP Wave System, which treats the neurological origin of pain, not the symptoms. You will learn how to increase your range of motion and how you can move freely without pain at any age. You will learn how you can try one free treatment from one of our local providers. Denis Thompson has 25 years' experience working with top athletes and non-athletes of all types. He has treated thousands of patients with better than a 95% success rate. His list of athlete clients reads like a who's who of the sports world. Listen and find out how the ARP Wave System can benefit you. And now, here's your host, Denis Thompson.
Good morning and welcome to Pain Free Today. I am your host, Denis Thompson, and we have a very, very lively show today. We've been on the road. Last week we were not live. Today we are live. We're in Houston, Texas. We'll be touring Texas all week, working with and speaking with surgeons here in the great state of Texas pertaining to our therapy, which we call neurotherapy, which is the ARP Wave System. We've been talking about this for probably the last 7 to 10 weeks for those of you who have been listening in. And for the new listeners, let me tell you basically what neurotherapy is and what it is not, more importantly. Neurotherapy is a therapy that is designed to be used in addition to everything else you've presently done. Presently, what you have probably gone through is traditional physical therapy, occupational therapy, sports rehabilitation, those types of therapies. Those types of therapies are extraordinarily effective. However, there is one downside, and that is that they are only working on the place where the problem ended up, not the neurological origin of where the problem came from. Now, that's the heart and soul of our entire system. Everything we do is neurological. Nothing we do is physiological. So think of it as two sides to a coin. The first side is the physical side, which you have probably already experienced. And the other side of that coin is something you probably never have experienced, and that is the neurological side. All of the specialists that you've seen up till now, if you are a potential patient, have addressed your condition, your symptoms, your issues as a physiological phenomena. So wherever you have pain is where the problem ended up. It is not where the signal is coming from, which is causing the pain. Wherever you have a tear, wherever you have a torn tendon, ligament, cartilage, meniscus, wherever you have a strain or a sprain, is where the problem ended. It is not where it came from. Think of it this way. The muscles in your body are designed to be shock absorbers, and that is a neurological function. It is not a physiological function. Example, you could be the strongest person in the world and not be able to absorb force and still have an injury. And just ask the National Football League, and they will tell you that happens every day of the week with men that are extraordinarily strong. So ask yourself the question, why do they get hurt? And it has nothing to do with the athletes are getting bigger, stronger, and faster. It has to do with they are not neurologically prepared to play that sport. Now, what we've done is we've created a complete new therapy to be used in addition to physical therapy. It does not take the place of anything. It adds to it, and it adds the neurological component. So the very first thing that we do when we see a patient, whether it be a post-surgical patient, whether it be someone who is in chronic pain, whether it be a sports injury, it makes absolutely no difference. The very first thing that we must do, since we are dealing with the nervous system, is make sure that the nervous system is sending the right electrical signals to the muscles to allow those muscles to do what they are supposed to do, which is absorb force. If those muscles cannot absorb force, which in about 95% of you listening to this show today, your muscles are totally incapable of absorbing force. So if that's the case, then that force is going to go someplace that it's not designed to go. Tendons, ligaments, joints, cartilage, et cetera, et cetera, et cetera. Bones. None of those are designed to absorb force. There's only one thing in your body designed to absorb force, and that's your muscles. Now, the muscles are the outward expression of the nervous system. So what we do is we test the muscle's ability to absorb force. And it's a very simple test. I call it an external EMG for the providers listening to the show. And I know we have quite a few doctors, quite a few surgeons that are going to be listening to the show today. So this will be kind of a round robin conversation about what neurotherapy is all about, what it can be used for. And for those of you who have had a failed surgery, for those of you who have been told you need surgery, for those of you who have already had surgery and just aren't recovering as fast as you want to, this will be a very, very interesting show for you because we'll be focusing on the surgical aspect and how the ARP Wave System neurotherapy can dramatically help you. So the very first thing that we do in our system, and it is a therapeutic system, is we have to test you to determine is your nervous system working or not. And again, about 95% of the time it is not, so that means that we have to basically turn on that nervous system. We do that with a very proprietary technique and a very proprietary piece of patented electronic equipment. And proprietary means we're the only ones that have it, obviously. So what we do is the next step is that we must turn on that switch. So think of the nervous system as an on-off switch. When it's on, it's absorbing and allowing your muscles to absorb force. When it's off, that force is being transferred to places you don't want it to go to. So if you have a knee pain, if you have hip pain, if you have shoulder pain, if you have carpal tunnel, if you have neuropathy, if you have any pain anywhere in your body, understand your muscles around that spot are not doing their job. Just that simple. And once we transfer the force out of the area that bothers you into the muscle that isn't bothering you, you no longer will be exhibiting the symptoms. The problem is you can't do that on your own. So the very first thing that we do in our therapy is that we have to turn on the nervous system. And the way we do that is we basically reinstall, kind of like a software program. We reinstall the very first reflex pattern you ever learned how to do, which is how to crawl. So if you've been to a chiropractor, if you've been to an osteopath, they are adjusting your physical body to improve your neurological capacity. We, with neurotherapy, are adjusting your nervous system, allowing you to function more efficiently through the muscles. Just that simple. So we're doing the exact opposite of what everybody else does. And because of that, we are the other side of the coin. So once we get the nervous system working correctly, the next thing we have to do is we have to identify where is the signal coming from that's causing you the pain. So let's say you have knee pain. Let's say you have a shoulder pain, hip pain, back pain. You know, those are neck pain. Those are pretty much the major areas that people suffer from. Understand that wherever you have pain is where the problem ended up. It is not where it is coming from. Now, traditional therapy is going to work on where it ended up. Neurotherapy is going to work on where it came from. Which one do you think is going to get you to where you want to get faster? Well, obviously, if you're working on the origin of a problem and get rid of the origin, the symptoms are going to go away pretty quickly. And that's the whole theory behind neurotherapy, is work on the origin of the problem, not work on the problem. Because working on the problem is going to be a very time-consuming and very frustrating experience. Evidenced by the fact that many of you are still in pain after having gone through that whole process. So all we're saying is that neurotherapy is just another additional tool to allow you to speed up your body's natural recuperative ability. So in our system, the first thing we do is test to see if the nervous system is working correctly. If it is not, we get it to work correctly. The second thing we do is we use our proprietary equipment. We scan your body, and we're scanning for where the problem is coming from. Now, every other diagnostic tool you have ever used if you're a provider, and every diagnostic tool you've gone through if you're a patient, has told you one thing and only one thing, and that is where the problem ended up. It does not tell you where the problem is coming from. However, our diagnostic mechanism is going to identify exactly where the neurological signal is coming from, causing the physiological symptoms. So we're going to scan you with our proprietary equipment. And once we identify those spots, we then begin to do the treatment. Now, the treatment consists of neurologically disrupting your present pattern and transferring force out of that area into healthy tissue. And what that means is that if you are in pain, you are not moving correctly. It's impossible. And the reason you're not moving correctly is because your brain says, if I move this way, it's going to hurt, so you move a different way. So what we do is we find out where that signal is coming from. Now, if you would like to try this therapy at absolutely no cost or obligation, please listen carefully to the next message that you will hear. I will be right back.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Dennis Thompson. We've been talking in the first segment of the show here about neurotherapy, what it is and how it works. And we got up to step 2 of the therapy, and that is how we break down a pattern. And the way we do that is we identify exactly where the signal is coming from. We then watch the patient, you, if you're in pain, we watch and see how you move. Because how you move is basically complicating the issue. As you're moving away from the feeling of pain, you are creating a whole host of problems, not to mention the fact that you are consistently sending a signal to your nervous system, through your nervous system, to your body, that there is a continuing problem. So it's focusing on that problem. What we have to do is break that pattern. And the way we do that is quite simple. We identify how you're moving now, and then we get you to change your movement. The trouble is you cannot do that on your own. So what we begin to do is we begin to do what's called neurological re-education and creating a neuroplasticity to allow you to break those habits. Example, if your back hurts and if your legs hurt, I guarantee you if you're sitting in a chair and get out of that chair, the first thing that you do is you lean forward, and then you push off of the chair, your knees go forward of your toes, and then you gradually stand up. Now think about that in pure physical sense. When you lean forward in any chair, and you can watch anybody get out of a chair, most people do this. Reason being, most people have no earthly clue how to utilize their legs. Example, when you lean forward, if any of you have ever taken physics, where is the force at? Well, the answer is it's in the middle of your lower back. Now, what happens to be your condition if you have a back issue is your lower back. Why do you suppose that is? Because every single time you lean forward, you're loading your lower back up with force that it's not designed to absorb, so consequently, it's going to become irritating. And if it becomes irritating, you're going to get inflammation. And if it becomes inflammation, you're going to get pain. The muscles are going to react to that. Just a simple change in the way you stand up is going to dramatically change your lower back pain. And if you do not believe that, have your son, daughter, or wife, or husband stand in front of you. You sit in a chair, and these are the rules of the game. You must put your arms fully extended out. They grab a hold of your wrists. Under no conditions can your upper torso come forward, and under no conditions can your knees come forward. You're going to pull back against them a little bit. You're going to stand up. I guarantee you if you do that, you're not going to have the pain that you used to have in your back. Why? Because all I did is transfer the force out of your back into your legs where it's supposed to go. Again, the trouble is you can't do that on your own. It is a neural pattern, not a physical pattern. No amount of physical training is going to do it. So we have to break that neurological pattern. The way we do that is we use our proprietary equipment. We hook you up. We assist you in moving correctly, and we stimulate you at the same time. Now, as we're stimulating you with a stimulus, it becomes difficult to stand up if we're using the sit and stand example. And then all of a sudden, by the third repetition, your brain figures out that you can do it, and then all of a sudden you do it, and you're pain-free. The second we raise the stimulus, guess what you, the patient, do? You immediately go back to your old pattern again. Why? Because we haven't broken you of that pattern at that stimulus. What this is called is neurological re-education, and there is no amount of physical therapy, no amount of occupational therapy, no amount of any other therapy that can accomplish this task because it is a neural pattern, not a physical pattern. Same as force absorption is a neural pattern, not a physical pattern. So, just by getting you to move correctly, we're transferring the force. So if we can just change the way you move, and we can transfer the force out of damaged tissue, every provider listening to this show today knows that if we could flood damaged tissue with blood, which nobody believes you can, but if you could do that, and then you could take force out of that tissue would heal very, very quickly. Everybody knows that. The problem is no one knows how to do it. And the reason no one knows how to do it is because those are neurological functions, and most of us, including myself, were trained in the physical side of the equation, not the neurological side of the equation. Neurologists aren't even trained in the neurology of injury. So you see that there's a chasm there. There's a gap there. And that's what neurotherapy does. It fills that gap. It is not designed, and I repeat, not designed to replace physical therapy, occupational therapy, strength rehab, any type of sports rehab. It's not designed to replace it. It's designed to add to it, to flip the coin, to add the other side of the coin. And by doing so, you have the ultimate of ultimate rehabilitation systems. You have a combination of software and hardware. Think of your body as a computer. If you brought your computer into Best Buy, as an example, and you had a hardware problem and you turned it over to a software guy, you are not going to get the results you were looking for. Well, your body's the same way. Your body happens to be one of the most efficient computers ever created. So why in the world would you only address the hardware when what drives the hardware is the software? That's what neurotherapy does. It addresses the neurological component of the process. It does not address the physical component. However, a byproduct of addressing the software is the hardware works a whole heck of a lot better. So I've been asked numerous times over email and through conversations with different doctors and different practitioners if neurotherapy can assist in post-surgical complications. Well, the biggest post-surgical complication, if any of you have ever had surgery, if you've had a sports surgery, if you had surgery 10, 15, 20 years ago, if you had surgery a year ago, you're going to have exactly the same situation, and that is the surgically repaired site doesn't look, feel, or act like the non-surgically repaired site. We call that post-surgical atrophy. And everyone knows that. Everyone knows that if you have a knee problem, that leg is not going to be the same as the other leg. You know, close, but it's not going to be the same. It's not going to have the same muscle strength. It's not going to have the same muscle density. It's not going to be able to do the things it used to do at the same level it used to do them at. So ask yourself, why? Why have we had that same scenario year in and year out? Because we are addressing it as a physical phenomena, when in reality it is a neurological phenomena. Example, if I tell you that you're a television set, as an example, let's just think of yourself as a television. And if your TV has a short in it, does the TV work? And the answer is no. The next question is, does it make any difference at all where the short is? And again, the answer is no. It does not. Well, your body's the same way. So if you have an electrical short in your electrical system is not going to do what it is supposed to do. It's got a short in it. What neurotherapy does is identifies where that short is, gets rid of it, so the neurosystem can support the physical system. Without that, you are not going to eliminate atrophy. What about failed backs? What about fibrotic knees? What about just plain simply, it just takes too long to get rid of the pain from surgery? What about all those things? We've all heard about them, but why do they occur? Well, I submit to you the reason they occur is because we are only dealing with one side of the coin. We're not dealing with the other side of the coin, which is the neurological side. Example, if you've ever had any type of therapy, electrical therapy, ultrasound therapy, laser therapy, ice therapy, whatever kind of therapy you've had, that therapy is addressing where the problem ended up. It is not addressing where the problem came from. As a matter of fact, where the surgeon did surgery is where the problem ended up. It is not what caused the problem. Now, what I mean by that is if you have a bone on bone and you have total joint replacement, say for your knee, the surgeon is extremely skilled, puts in a brand new knee, tells you all the things that you're going to be able to do and not do, and then you're basically turned over to therapy. Well, let me ask you a question. Why are you bone on bone? It has nothing to do with your age. It has nothing to do with you overused it. What it has to do with is your muscles above your joint line and below your joint line did not do what they were supposed to do, which is absorb force. And if those muscles cannot absorb force, that force is going to go into your joint. And it's going to wipe out everything in that joint space. And then sooner or later, guess what? You're going to be bone on bone. The fact that you put a brand new knee in, did that change the fact that your muscles are now miraculously able to absorb force? The answer is 100% unequivocally no. So therefore, if you are a young person, let's say you're 35, 40 years old and you have a joint replacement, I can almost guarantee you now with the technology that we have available to us, that about 20 years from now you're going to have another one. You know, if you had it done 20 years ago, in 10 to 15 years you would have another one. So why would you have to have another joint replacement if the first one solved the problem? Well, you wouldn't. But firstly now, because what I've been saying sounds way too good to be true. And there's really only one way you're ever going to know if neurotherapy can help you, and that's to try it. Listen carefully now to find out how you can try neurotherapy locally or anywhere in this country at absolutely no cost or obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website www.painmanagementnetwork.com and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Dennis Thompson, and as you heard on that last spot, we're offering you the opportunity, if you're a patient, to try neurotherapy at absolutely no cost or obligation whatsoever. And we have doctors all over the United States who would absolutely love to have the opportunity of demonstrating to you the benefits of neurotherapy. However, before we go to that step, I'd like to just ask you one simple thing, and that is that you're already seeing a doctor. What I would like you to do is I'd like you to give your doctor a call after the show today and just say, hey, doc, I was listening to Pain Free today and heard about this neurotherapy, and I would really like to try it in your office, and they're offering the opportunity to do that. Would you be interested? And if the doctor said yes, great. What we'll do is we will basically have one of our representatives, if we have a representative in the area, come out to the doctor's office, set up an appointment with you, and our representative will take you through the entire neurotherapy system. We will evaluate you. We'll do your first treatment free. And then and only then will you ever know if this system is going to work for you. And the way to set that up is just simply call your doctor, ask them if they are interested. Just get in touch with us at 954-256-0045. That's in the South Florida area. And that number will also set you up for any place in the United States because we have representatives all over the United States. And if we have an area where we do not have a representative, we will basically send everything directly to your doctor, no cost, no obligation. We'll do your session over the Internet, as we've done over 75,000 patients all over the world that way. And at the end of that session, both you and your doctor will see firsthand how neurotherapy can fit into your doctor's practice, but more important for you, can dramatically change your quality of life. So, again, that number is 954-256-0045. After you've talked to your doctor, if your doctor says no, just let us know, and we'll basically get you set up with someone very close to you who will be more than happy to give you your first session absolutely at no charge, no obligation. Because really, there's only one way you're ever going to know if what I'm saying is true, because it sounds way too good to be true. It has to try it, and the proof is in the pudding. When you go through a session, I can guarantee you that 95% of you are going to see results that you never dreamed humanly possible. I'll give you an example. I was in Phoenix, Arizona last week, and I worked with a very, very well-known neurosurgeon. And I was an observer in one of the surgeries that he did. And this patient exhibited extreme neuropathy pain, where there was, it was so tender, the tissue was so tender they couldn't even do an ultrasound. The patient had had a number of surgeries with other surgeons, which kind of complicated the problem. But this poor young lady was in just dire straits. She couldn't flex her foot. She couldn't walk. She had to be on crutches all the time, just in basically in suicidal pain. Prior to the surgery, we had the opportunity to meet with her, and she was totally incapable of dorsiflexion or plantar flexion. She couldn't internally or externally rotate her foot without just extreme pain. Heavily medicated. Hasn't been able to basically have any type of life other than being in basically almost in a comatose state from the medication, just to ease the pain. And still the pain with that much narcotics was still 6 or 7 on a scale of 1 to 10. So I mean, she was a very severe case of extreme pain. So we, in the evaluation period, I had her attempt to move her foot, and she hadn't been able to do that, couldn't wiggle her toes, couldn't do anything. The pain was just excruciating. So to make a long story short, surgeon did an absolutely phenomenal job of releasing the nerves from the entrapment that they were in the scar tissue, and it was just a phenomenal surgery. It was a 3-hour surgery on her foot. And when she was done, the surgeon said, now I would expect, she was heavily medicated, so we're all talking, and the surgeon the surgeon said, I would expect post-surgical contracture, which means that the toes are going to pull up, the calves are going to get really tight, and she's not going to be able to move her foot. We're going to have a lot of swelling. And this was done in a surgery center, a very well-known surgery center in Scottsdale, Arizona. And so after the surgery, we put our proprietary equipment on her as a post-surgical accelerated recovery program, which we have. And as we did that, instantaneously, the cramping in her leg went away, toes became flaccid, there was no contraction, no post-surgical contracture. And about an hour and a half, 2 hours later, when she was released from the surgery center, she could dorsiflex and plantar flex. She could do internal rotation, external rotation. She hadn't done that for literally years without pain, and she did it with very little pain. Of course, she was heavily medicated. The fact that she could do it absolutely astonished the surgeon. The reason for that is it's completely different than anything that this surgeon had ever seen before. All we did is work on the neurological component of the process. Keep in mind, the nervous system sends a signal to your muscle to protect you. And the muscle protects you by contracting concentrically. In other words, it closes up. It balls up. Kind of take your fist and ball it up. That's a concentric contraction. What we did is we sent a signal to offset that signal to allow that muscle to go to what's called eccentric contraction, which means that that muscle elongated. It did not shorten. And when that happened, obviously the patient is a whole heck of a lot more comfortable. So I can tell you that in a post-surgical environment, the ARP Wave System neurotherapy is a phenomenal accelerator to recovery. And again, it all boils down to we're stimulating the opposite side of the coin. We're working on the software that controls the hardware, not the hardware itself, meaning the muscles. We're not worried about the muscles doing certain things that they normally do because we're going to be basically sending a signal to allow them not to do that. So with that in mind, the surgeon was very, very excited to see everything that was going on. It was absolutely fantastic. So to answer the question, can the ARP Wave System be used in a post-surgical environment? And the answer is absolutely it can and should be used because it is an accelerator to the recovery process because it basically allows the muscles to do what they're supposed to do, which is stabilize. They protect when you're hurt. They stabilize when you're not hurt. So we want to get the muscle into stabilization as fast as possible, and that, again, is a neurological pattern, not a physiological pattern. So with that in mind, I've been asked many times by surgeons and by patients who suffer from CRPS, used to be called RSD, and sometimes it usually happens after a surgery, after a severe trauma. And can the ARP Wave System help with CRPS or RSD? And the answer is yes, it can. And we treated thousands and thousands of patients with chronic pain caused from surgery, caused from CRPS. And the way we do it is exactly what we talked about in the earlier segment of the show. We identify, does the nervous system do what it is supposed to do? If it doesn't, we have to get the nervous system firing the way it should. The second thing we have to do is we have to identify where the signal is coming from. So if you have CRPS in the foot, I can guarantee you that the signal of that pain is not coming from your foot. It's coming from someplace else. It's landing up in your foot, but it's definitely not coming from your foot. So what we do is we find out exactly where that signal is coming from. Once we identify where the signal is coming from, we then have to break that pattern. And we break that pattern by letting your cognitive brain, your brain see you do things that normally you couldn't do before. So if you couldn't move your foot and all of a sudden you can move your foot without pain, your brain says, hey, that's kind of neat. I can do that now. So guess what you're going to do? You're going to do it. Conversely, if you move your foot and it hurts like sin, you're definitely not going to move your foot because your brain said, no. I'm not going to do that. So what we do is we break those patterns. And those patterns are a neurological pattern, not a physiological pattern. And neurotherapy is a very, very effective tool to be used in addition to everything else we presently do. It just adds the software piece to the hardware puzzle. So again, thinking in terms of simplicity, if you're a computer, you have two sides to the computer. You have a hardware side and a software side. Your body is a computer, and you have two sides to your body, a hardware side and a software side. Neurotherapy works on the software side. Everything else works on the hardware side, including your surgeon, including your physical therapist, including your athletic trainer. They're extremely skilled at what they do, but they're skilled and trained in the hardware side. They are not skilled and trained in the software side. That is why it is so important to add neurotherapy to a practice, is because now we have both components able to work in harmony together for the benefit of you, the patient. So if you're in pain, if you've been told you need surgery, if you've had surgery and it was a failed surgery, for whatever reason, give us a call. There is absolutely only one way you're ever going to know if neurotherapy can help you, if it can be the missing piece, and that's to try it. And if it's done in your doctor's office or done in a doctor's office, it costs you nothing. There's no obligation. What in the world would possess you to wait? We know we can help you. We've treated 75,000 people just like you. Thousands of the most elite athletes in the world with better than a 95% success rate. We know what the end result's going to be. The trouble is, you don't. So, give us a try. You have absolutely nothing to lose. Listen carefully to how you can try neurotherapy at no cost or obligation.
Individuals who have been unsuccessful in eliminating their pain are invited to obtain a free ARP Wave System treatment. Register now on our website at painmanagementnetwork.com to arrange a free ARP Wave System treatment from one of the doctors in our ARP Wave South Florida provider network. You can also call 954-256-0045 in order to schedule your free evaluation and first treatment. Contact us now at 954-256-0045 or visit our website www.painmanagementnetwork.com and register to begin a new life pain-free. The ARP Wave Provider Network is also currently looking for doctors to join our network. We have an increasing number of patients who are looking for doctors to perform treatments using the ARP Wave System to help them eliminate pain they are experiencing. Contact us now at 954-256-0045 to have a representative come out and see you, or visit our website, www.painmanagementnetwork.com, and register for an appointment with one of our representatives. Once you are in our network, we can start referring you patients located in your area looking for doctors performing ARP Wave System treatments.
Welcome back to Pain Free Today. I'm your host, Denis Thompson, and we've been talking about post-surgery most of today. We've been talking about the neurotherapy, the ARP Wave System neurotherapy. And since we're right smack in the middle of football season right now, I have a tremendous number of inquiries pertaining to football injuries such as ACL, MCL, PCL, meniscus, strains, sprains, et cetera, et cetera. They all revolve around one thing. What will neurotherapy do for me? Well, we have basically over 600 National Football League players as clients who have our consulting services in place. And we treated thousands and thousands of players all over the world, whether it be American football or whether it be European football, better known as soccer in this country. The answer to the question is, can neurotherapy help with athletic injuries? And the answer is absolutely yes. And it will speed up the recovery of any type of injury. For those of you in South Florida and other areas, we are now going to be affiliated with OrthoNow. OrthoNow is a group of orthopedists who have opened up an urgent care type of facility for just this sort of thing, to where you can walk in at any time. You can be serviced by some of the most elite experts in their field without an appointment. It's designed to be a facilitator to eliminate your need to go to an emergency room or an urgent care facility. Here you're going to get with sports specialists for any type of injury or any type of pain. And that group is OrthoNow. And if you'd like more information on them, just give us a call at 954-256-0045. So let's talk about some of the common injuries that we see in football. Ankle sprains is probably one of the biggest. Hamstrings would be number 2. Hip injuries would be number 3 probably. Shoulder injuries probably number 4. Wrist number 5. All of those injuries are caused from one simple fact, and that is those athletes did not neurologically function the way they should have. Example, if you get an ankle sprain, what gave way, your ankle or the muscles above your ankle? Well, I submit to you the muscles above your ankle gave way, therefore all the force went into your ankle. Unfortunately, we treat your ankle. Well, the ankle's not the problem. The ankle is where the problem ended up. And if we treat your ankle and continually treat your ankle, and you have a high ankle sprain, we're going to be treating it for about 8 to 10 weeks. However, if we treat where the problem came from, which is not your ankle, you're going to be ready in about 5 to 6 days. Now, I know that sounds absolutely incredible, but I'll tell you a classic example. In the Super Bowl, when the Indianapolis Colts played the New Orleans Saints, the biggest story of that Super Bowl was, is Dwight Freeney going to play in the game? Dwight Freeney had a grade 3 high ankle sprain, which means he literally tore the ligaments off the bone. And that traditionally is a 10-week recovery period. This is 2 weeks prior to the Super Bowl that this happens. Well, Dwight's been a client of mine forever, and it was a freak accident. It should have never happened, but it did. It happened in San Diego in the rain, and he should have never been playing, but he was. It was garbage time in the game. So he did his famous twist and spin, and his foot got planted, and he just ripped all the tendons and ligaments. So, again, his foot swelled up, and the biggest story of that Super Bowl was, is Freeney going to play? Well, for those of you who watched the game, know that Dwight played in the game and had a sack in the first quarter. Now, how is that possible when it normally would take 10 weeks? And every talking head specialist on ESPN and Fox and all the different doctors were saying that there's no way he was going to play. MRI said he was no way he's going to play. Yet he ended up playing and had a clean MRI. How is that possible? Well, the answer to that question is exactly what we've been talking about all day today, and that is all I did is transfer the force out of Dwight's ankle, put it into his leg muscles where it should have gone to begin with, flooded the ankle with blood, and that tissue healed very, very quickly. The ankle is not the problem. I did not treat Dwight Freeney's ankle. I treated where the problem came from, and it was nowhere near his ankle. So, with that in mind, that should tell you right away, if you're a high school athlete, a college athlete, a professional athlete, and you've asked the question, can neurotherapy help you? Well, if you're in the pros, you can ask any person on any team, and they will tell you the answer is yes. If you're a high school athlete or a college athlete, and if you're in a D1 school, you can probably ask some of the players, and they'll answer yes. If you ask the trainer, they'll answer no, because it's done outside of the trainer in most cases. Now, as we start to affiliate and align ourselves with the most elite orthopedic surgeons in the entire world, that issue will go away in a nutshell. However, right now, the answer to any of your questions in the South Florida area is yes, we can help you. Yes, we can get you back on the field quickly. Yes, we can expedite your recovery beyond your wildest imagination. It doesn't make any difference if it's a strain, a sprain, a slight tear. It's very, very quickly reversed. And again, our affiliate there is Ortho Now, and they are a group of orthopedic surgeons, and you can contact them directly, or you can contact us at 954-256-0045, and we'll get you into them as fast as humanly possible. So the answer to the question is neurotherapy effective for athletic injuries? We've treated thousands and thousands of the most elite athletes in the world from every kind of sport imaginable, and yes, it is very, very effective because neurotherapy works on where the problem came from, not where the problem ended up. If you tear an ACL, the ACL is not the problem. If you have a cartilage problem, the cartilage is not the problem. If you have a strain in the knee or the wrist or the shoulder or anywhere, the strain is not the problem. It's where the problem ended up. For those of you in athletics, for those of you who are weekend warriors, for those of you who have pain, there's really only one way to know if what I'm saying is true. I guarantee it is, but you need to know for yourself. That's to try it. So if you've had an ankle sprain, if you've had any type of sports-related injury, give us a call. Give us a call at 954-256-0045. We'll give you a no-cost, no-obligation evaluation and your first treatment at no cost. You'll know instantly. Within minutes, you will know if we can help you or not. You come in walking with crutches on, you're going to leave without crutches. Just that simple. Why? Because where you think the problem is where the problem ended. It is not where it's coming from. We're going to find very quickly where it came from, and very quickly we're going to change the pattern. Very quickly we're going to transfer the force out of that area. Very quickly we're going to drive blood into that area, and that tissue will heal very quickly. But again, there's only one way to know for sure, and that's to try it. And if we've taken all the cost away, all the obligation away, all the fear away, it can't possibly hurt you. And it's being done by some of the most extreme specialists in the country in their office or in your doctor's office. What in the world do you have to wait for? There's nothing to wait for unless you just enjoy being in pain. So, seriously, can neurotherapy help you? Absolutely. Can neurotherapy help everyone? Absolutely. Is neurotherapy an addition to any practice? Absolutely. Why? Because it addresses a completely different side of the condition. It addresses the neurological origin of the physiological symptoms. So wherever you have pain, wherever you have restricted range of motion, wherever you have a complication is where the problem ended up. It is not where the problem came from. So keep that in mind. And as you listen to these shows, hopefully it spurs you to think, hey, you know, that sounds interesting. Or no, I don't think that's true. Or it just causes you to question. Because, again, there's only one way you're ever going to know if neurotherapy can help you, and that's to try it. Till next week, this is your host, Denis Thompson. Have a pain-free day.
You've been listening to Pain Free Today with your host, Denis Thompson. Denis is the creator of the ARP Wave System. Send in your questions for next week's show to questions@painmanagementnetwork.com. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.